sleepyhead. Wake up. Can you open your eyes for me? Hey. Just try and open your eyes for me. Oh, that's great. It's okay. You're going to feel sleepy for a little while. Alright. The surgery is all over now. All done. And my name is Sarah, and I'm the operating department practitioner that is looking after you in the recovery unit. Okay, so I'll be doing some checks on you and making sure you're all stable before I send you off to go and recover further on the ward. Alright, you would have seen me earlier. Do you remember me? Okay, alright. Okay. Well, let me just give you just a few nice breaths of the oxygen there. Just take some nice deep breaths for me. There we go. Just help you wake up a little bit more. All right, so let me just take a little look at you. Okay, can you give your fingers a little wiggle for me? That's great. Okay, how many fingers am I holding up? Lovely. Okay, can you see me clearly, or are you still a little bit blurry? Alright, that's fine. Okay, well you just relax, you haven't got to do anything. Alright, and I'm just going to check you over. Alright? Okay. I've just got your chart. And everything went well with your surgery. No complications. All right. So, firstly, I'm just going to check your blood pressure. All right. So I'm just going to pop a cuff onto your arm here and inflate that. All right. Okay. Just lie still. Don't worry. There we go. Let's get that round there. Stethoscope in. Let's pop this onto your arm, okay, and now just inflate the cuff. That's fine. So, let me just remove the cuff. Right, I'll just make a note of that. Now, we've still got your ECG leads on at the moment, okay? That's just monitoring your pulse there for me. I'm just going to have a little listen to your chest while I've got the stethoscope in my ears. All right. Okay. Just breathe normally for me. That's great. Okay. And we'll just check your oxygen sats. Okay. I'm just going to pop this onto your finger. All right, it won't hurt. There we go. That's all good too. You're checking out fine. So how are you feeling at the moment? Feeling a little bit chilly, okay. Well, we have a heated blanket on you, but I'll just pull the other blanket over as well. It's perfectly normal to feel cool after anaesthesia, okay? Be a little bit chilly for a while. It's just the effects of some of the medications and the surgery. Okay. I'll do that for you. You've got a sore throat? Okay. Again, when you have surgery, we have to put an airway in, okay? And although the surgeon is extremely careful with this, and the anaesthetist, they do their very best to do it without causing too much trauma, but the fact that you've actually got an airway down there, okay, for a length of time can make your throat feel very sore and scratchy for a little while afterwards. It's not an infection, it's just an irritation, okay. Now I know you're dry and you probably want a drink, but I can't give you anything just yet, okay. We just need to leave it a little while longer before we get you onto the ward and give you a drink, okay. Right, so let me just sort the extra blanket out here for you on top of your heated blanket. There we go. I'm going to take your temperature now anyway. Alright, there we go. The shivering should stop quite soon. Okay, so let me just use this device, just a thermometer. I'm just going to take your temperature. Alright, I'll put it by your ear on your left side. You'll hear it beep. Okay, it's not going to go into your ear though. Okay, alright, there we go. That's all good. That's what we'd expect after surgery, so that's fine. Okay, lovely. So on a scale of 1 to 10, how's your pain at the moment? Okay, so you're in some discomfort, okay. Well, obviously, as the anaesthetic wears off, you're going to find that the pain does creep back a bit. But we have given you something during your surgery, but I can give you something more now to help keep that under control. I've got a list of medications which I'm allowed to give you based on what the surgeon and anaesthetist have requested. Okay, do you have any nausea at the moment? You are feeling a little bit sick. All right. Okay, again, that's a very common side effect from surgery and some of the medications, but I can give you something for that too, because what we gave you during surgery is probably worn off or about to wear off, so that might be why you're feeling a little bit yucky now. Okay, have you got any dizziness at all? a little bit lightheaded. Yeah, okay. So I'm just going to double check the meds. Okay. Right. So I've got those here. So before I go and check anything else, I'm going to give you some medication, okay, to make you feel more comfortable. Yeah? Okay, let me just double check your ECG is all doing well there. Yeah, all connected nicely. Okay, just give me a moment and I'll sort your medication out. So you just relax, you can close your eyes if you want to. Yeah? Okay. Okay. So now I'm going to give you your medication, okay, to get you feeling better. Alright. Alrighty. So the first one is going to be your pain relief, okay, and it's going to go straight into your cannula. Alright, the cannula is still feeling comfortable for you? Lovely. Okay, nice and still for me. Just keep that hand nice and still. I'll just pop this in for you. Alright. That's great. Okay, that's that one. And this one is the anti-nausea medication to stop you feeling so icky. And this one works really quickly. Alright, so again, it's just going into the cannula. Alright. Okay, keep nice and still for me. Lovely. There we go. Well done. Let me just update that. Okay. That's fine. Okay. How are you doing there? Okay. Right, so what I need to do now, given you your meds, is I need to just check your dressings. Alright. Okay, you're not going to have too much area here, are you? No. I'm just going to pull the blanket back. Okay. There we go, let's have a little look. Might feel a little bit sore for a while, but I'm not going to be pressing on too hard. I'm just really just checking the dressing. Okay, and there's no weeping or no bleeding from any sutures. Alright, okay. So I'll just a little press around there. It's quite a thick, comfy dressing you've got on. Okay. That's looking good. I'm sorry it's a little bit sore. But the beauty of the laparoscopic surgery that you've had on the abdomen is that it's far less invasive. The wound isn't going to be anywhere near the size of traditional surgery, and you generally will recover much quicker, so that's good. Alright, that's looking all fine to me. Let's pop that back. Right. Just going to have a temperature check on this side. Okay, just relax. All good there. You're checking out really well. So, once we've got you more stable here and you're back on the ward, I don't see any problem with you potentially going home later today. You're checking out fine at the moment. If the ward are happy with you afterwards, then they'll probably give you some extra dressings or change that dressing if need be before you go. But if you can eat and drink and you feel good and you're still checking out good on the ward, then you'll be able to go home later as scheduled. Yeah. Good. Okay, let's have just a quick check of the ECG there. Okay, before I remove those, I'm just going to just check your blood pressure again. Okay. So, let's just pop the cuff on. Okay. Put the stethoscope on your arm. And inflate the cuff. That's all good. There we go. So you're feeling a little bit more awake now? Good. That's fine. Feeling a bit warmer now? Good. I'm going to remove this blanket now. Don't want you getting too hot. Okay. So, can you just give my hands a little squeeze? Perfect. Okay. Oh, I know. Well, as soon as we can get you on the ward, we'll get you some fluids. It's awful being dry, isn't it? I know. It shouldn't be too long now, okay, before we can let you take some fluids. And before you know it, you'll be eating something and then hopefully on your way home. The ward will give you all the guidance on the things to eat and drink and how you might feel for the next day or so and how to look after yourself. Because general anaesthesia, although you'll recover enough to go home, it can have effects on you for a little while afterwards. Okay, you won't necessarily notice them all, but it can have a first reaction on things like your actual responses, reactions. Okay, you might feel more tired, which obviously can be from the surgery too, but more tired, a little bit dizzy sometimes. Okay, so, and you've got somebody collecting you. That's good. Okay, because we couldn't let you go home on your own after general anaesthesia, as you know. All right, that's good. Okay. Well, I'm happy with everything there. I'm just going to check your oxygen sats one more time. Okay. So let's have that finger again. There we go. That's fine. That's fine. So I'm now going to gently remove your ECG leads. Okay, and I'll get the ward to come and collect you and take you back there. Yeah? What a relief. Okay, and they can further look after you. all right on there. Just tell them if you don't feel great in any way, but they will be checking on you for a while. So I'm just going to remove the sticky pads off your chest, okay? Gently. There's one. Okay. Let's do this one. Okay. One here. Alright. You alright there? Good. There as well. Okay. Just this one here. Perfect. Okay, put those leads there. Right, I think I'm all ready to send you onto the ward, so I will leave you shortly and I'll contact the ward to come and collect you. Okay, you're feeling a little bit less nauseated now? That's great, okay. Hopefully that'll wear off anyway. And sometimes once you've had something to drink, a little bite to eat, that can actually start to feel better. Alright, obviously you're not eating for a very, very long time, but we can't have you eating before general anaesthesia, so... But once we're satisfied that you're going to be able to tolerate the food and drink, we'll make sure you've got something to fill your tummy up. Okay, so those checks all completed there. All right. Okay. Now, you lie back, relax. Okay, you can have a little snooze if you like, and I'll just contact the ward to come and collect you. Okay, and they'll look after you from there. Okay. Well, I wish you a speedy recovery, and I'm sure you'll be home later. All right then. Okay. Take care. Hello there. Sorry to wake you from your sleep. Hello, it's Sarah again. How are you feeling? That's wonderful. That's wonderful. Well, you had your surgery yesterday, and as you know, it was a success. I had no problems removing that gallbladder. Okay, it's all gone now, so it won't give you any more problems. Okay. Now I'm just going to check your notes just to see how you've been doing since I last saw you, okay? And I'm going to give you another examination today, check your dressings, and if all's well, we'll see about getting you discharged. How does that sound? Yeah, of course, no one wants to stay in hospital, do they? No. Well, you just relax there a second and I'll just check through the notes here. Okay, just check your last observations. So they were all normal by the look of it. Okay. Just checking what medicines you've been given. So you last had some anti-nausea medication yesterday after surgery. You just felt a little bit nauseous afterwards, which is normal. Has that calmed down now? That's good. Okay, so you've not had any anti-nausea meds today. Okay, how's your pain level on a scale of 1 to 10? 1 being not very much, 10 being unbearable. Okay, about a 4, mainly when you move. Okay. Right. So I could see that you've actually taken in some food and drink, which is wonderful. So you've had some soup, yeah? And some, what did you have? Oh, and some mashed potato as well, lovely. Okay, and you've had some scrambled egg for breakfast. That's more than I've had. Okay. Right, let's have a look here. The temperature was all fine. Okay. Oh, it's perfectly fine to feel tired for a little while after general anaesthesia. Don't worry, that can last for several days. Yeah, that's why we recommend that you don't drive for a while after you've had an operation, because it can actually affect your reactions and your thoughts and how alert you feel, okay, for some time afterwards, even though you're well enough to go home. Yeah, it's surprising how long the effects can last in some people anyway. Okay, so we've got that your friend will come and collect you. Yeah, when you're ready, that's good. Okay. But obviously at first we just need to make sure that you're all tip-top. Okay. Right then. Would you like a little drink of your water? Yeah, there we go. A drink of that. Save you reaching out and getting it. There. Perfect. Just say if you need some more. Okay. So I'd just like to do these few little checks, if I may. So firstly, I'm just going to check your temperature by popping this in your ear. All right. Okay. Pop that in there. Okay. Okay. That's perfect. Normal temperature, so that's good. No, we don't often prescribe antibiotics after this surgery. It's not usually of any benefit. If you do start to feel unwell in any way or get a temperature, obviously call the hospital, but we don't normally prescribe now. We used to, but we don't anymore. The only thing I'll be sending you home with today is some painkillers. Okay, if you need them, something a little bit stronger than paracetamol. You may not need them, but we like to make sure that you've got something if you are feeling a little bit uncomfortable. Okay. So, could you just open wide for me? I'm just going to have a little look in your throat, just to make sure you're okay after being intubated. Does your throat feel a little bit sore and scratchy? Yeah, that'll wear off very quickly. That's just from where we intubated you during the operation, okay? Just so we could get the air down and the gases, okay? Alright, so just let me just have a little look in there. That looks fine. Any pain when I press around? No, okay. Alright. Just have a little check around. Just under the jaw there, make sure everything's fine. Got no pain in your face? Okay, that's wonderful. So I'm just going to pop this on your finger, the pulse oximeter. Okay, just have your finger on your right hand. There we go. Okay. That's perfect. Oxygen sats are at 99, so that's wonderful. Pulse is normal at 75, that's perfect. Okay. I might just have a little listen to your chest while I'm here. You've not felt like you needed to cough or anything unusual, have you? No, that's good. Just going to pop this on your chest, okay? I'll give it a little warm up first. Okay. Are you comfortable with how you're sitting? Alright then. Just take a nice deep breath in and out. And again, in and out. Again. And again. Again. That's wonderful. Okay, just round the back a little bit there. And again. Again. Round there. Again. Could you just give a little cough for me? Okay, I know that might be a little bit sore with having the surgery. That sounds good. Okay. Just check your blood pressure while I've got the stethoscope in my ears. Okay. Alright. Just going to pop this onto your left arm first. There we go. Wonderful. Let's get that ready. Just pop the stethoscope on. And just inflate that cuff now. Just go a little bit tight. Okay. That's wonderful, very, very healthy. 122 over 80. Let's just try the other side. Okay. Put my stethoscope on there and inflate again. Marvellous. There we go. Let's get that off. That's more comfortable, isn't it? Okay. Wonderful. Jot a couple of notes down there. Alright. Just going to have a little press around your abdomen. You are going to be sore. I'm not expecting you not to be. Okay, but I'm just going to feel for a few particular things. Alright? Okay. Do say if it is too sore for you to tolerate. Alright. Okay. You're right there. Okay. Okay, good. Just a little bit lower down, okay. You are going to feel a little bit bloated for a while because of the gas that was pumped into the abdominal cavity there. That will dissipate over the next few days, so you just might feel a little bit uncomfortable if you don't wear loose clothing. Okay, but it will calm down. Alright, how does that feel? Okay, a little bit sore, yeah, that's okay. A bit sore there, yeah. just going to take a close look just below there. Yeah, that's all right. So everything seems okay there. Nothing seems too painful for you. Obviously there are going to be areas that are very tender just at the moment. Okay, but what I'm going to do, I'm happy so far with what I've found. So I'm going to change the dressings, okay, very gently, clean them up. If everything looks fine there, all your obs are checking out fine, you've eaten, you've been drinking plenty, which is really good, okay, you've actually opened your bowels and bladder as well, which is wonderful, and if I'm happy with what I find underneath the dressings, then I will get you discharged today, if that's okay. Yeah, you will need to rest for a few days, but the beauty of the keyhole surgery is that you don't have to spend days in hospital and you haven't got huge big scars. You've just got 4 little scars which will soon heal. Okay, so let me give you another little bit to drink. There we go. Yes, it's very warm in here, and also having anaesthesia can make you feel rather thirsty. Some more? Yeah. The nurse has noted that you've been drinking really, really well, so that's what we like to see. Yeah. And really there's no special diet that you'll need. I would stay off fatty food for a while. Too fatty food, but you should be able to eat pretty much as normal. We can survive well without our gallbladders. They're not essential, but yours did have a lot of gallstones, which was blocking the bile duct, hence the pain and illness that you were feeling. There you have another drink there. Yeah, but that's all gone now. No more problems with that. Okay, right. I'll just go and grab some dressings and I'll take a good look at your abdomen there and get you all freshened up. Okay, be back in a couple of minutes. Right then, shall we take a look at my handiwork? Okay, so I'm going to very gently pull off the 4 dressings, okay? They're the little incision points. It shouldn't hurt her. Okay, not very much anyway. Maybe a little bit of a pull as I remove it, but I'll be very, very gentle. Okay. Oh, here we go. Here's the first one. Okay. All right. Okay. Good. Another one. Okay, that's 2. Very gently removing that. Okay, and last one now. You're doing really well. Okay, that's perfect. Okay, they're super sticky. Let's put that down there. Okay, right then I'm just going to firstly take a little look around. Well, there's no weeping, so that's wonderful from what I can see. To shine my light a little bit there, just to give me a bit of a clearer view. Okay. Right. I'm going to give that a little wipe off now. I can't see any redness around. You've got no itching from the dressings, have you? That's okay. We don't want you to be uncomfortable. Sometimes people can react to adhesives. very special, refreshing dressings here to clean you up. Alright, just relax, my lovely. I'll be so gentle, don't worry. Okay, very gently wiping around. Is that okay for you? Tell me if you need me to stop, okay? Oh, I'm sorry, it's a little bit sore. You're doing really well. Okay, let's just go down here to this one. They do have a lovely smell, don't they, these wipes? Okay. That's looking wonderful. Don't be worried if you see a little bit of bruising coming out, that's quite normal. Okay. It doesn't mean we've been heavy-handed with you. It's just a natural reaction to obviously when we're pushing a little bit onto the surface and making little incisions and moving the laparoscopic tools around. Okay. Right, okay. So I'm now going to replace those dressings, alright. Some nice fresh ones. We'll also give you some dressings to change if you like. You can take those home with you and just gently change your dressings tomorrow. Okay. Okay, let's just pop this one on. Okay, so that one. I feel alright for you, my lovely? Good. Nice and gently. Okay. Alright, that's another one. Perfect. Okay. You feeling alright? On there. Okay. And the last one, which is just around the belly button area. Slightly bigger dressing there. Alright, let's pop this one down here. Okay, there we go. All done. Looking wonderful. Let's just write a couple of notes there. I can hear your tummy rumbling. Are you hungry? One thing that I will say is that sometimes after this operation you might find you get a little bit of diarrhea for a short time. It can be just a couple of days, or it can last a little bit longer. On the very rare instance, it can last for several weeks or more, but usually it resolves very, very quickly. Okay, just as your body adjusts to the levels of bile that are running through your system, because the gallbladder regulates the amount of bile, but obviously that's not there anymore, so it can vary quite a bit, and a little bit more can get through, which can cause some problems in the digestive tract. Okay, yeah, not saying you will, but look out for it, and it's not anything to worry about, unless of course it's very painful when it doesn't resolve. All right, okay. Like I said earlier, the soreness will last for a few days, but just take it very, very gently. Right, I'm going to remove your cannula in a few moments. I'm just going to prepare this paperwork for your discharge and the prescription. Okay, with the painkillers and obviously the dressings. Alright, okay, so let's just complete that. Alright. Right then. So I'm going to remove the cannula dressing very gently, and then I'll be gently removing that cannula. Okay? Perfect. We keep it in just in case you need other medications, but you've been off it IV now for several hours, so you're okay. Right, here we go. Very gently just removing this. This can sting just a little, I'm afraid. Just removing the cannula. Okay. You're a trooper, aren't you? Perfect patient. There we go, well done. Okay. So I'm now very gently going to remove this cannula. Okay. Okay, let's just hold that on there for a second. Sorry, it can sting just a little. There we go. Okay. I'm going to put a nice comfortable dressing over that now. Again, you might notice a little bit of bruising and swelling where the cannula's been in, but that's perfectly normal. Okay, this one actually looks very good. Sometimes they can bruise quite badly, but that's very, very good. Okay. Just gently peel this off. There we go. Keep your hand nice and still for me, my lovely, and I'll get that popped on there. There we go. Well done. How does that feel? Give your fingers a little wiggle for me. That's wonderful. Okay. Just like a little bit more to drink. There we go. Okay. That's perfect. Okay. Well, you're all ready for discharge, so we'll get your friend to come and collect you. Stay where you are just for the time being and I'll send the nurse along. Alright, and we'll get some meds for you from the pharmacy to take out with you. Okay. Obviously, we'll give you a leaflet and the nurse will explain a little bit more, but obviously there's numbers to call if you aren't feeling well when you get home. Okay. We will have a word with your friend just to say to drive very, very carefully, obviously, on your way home. Sometimes after general anaesthesia and the motion of a car can make some people feel a little bit dizzy or nauseous, and also we don't want any discomfort around your surgical sites there. Okay, so just very gently drive home. I'm not saying your friend is a maniac, but you know, really, really carefully drive and move very, very carefully just for a few days. Just go home and rest. Okay. Try and drink, you know, water, simple things. You're okay to have a little cup of tea for today. After that, you should be fine. As I said, you can eat your normal diet, perhaps stay off anything too spicy for a few days. Fatty foods, you might find at first they're a little bit harder to digest, so I wouldn't go too much on fatty foods straight away. Okay, you can have a little bit, but not too much. But after a few days, there really isn't any reason for you not to go back to a normal but healthy diet. Obviously, we recommend everybody has a healthy diet, of course. Yeah, but don't drink any alcohol for a few days. Yeah, obviously, alcohol is very hard for the body to process. It's a gastroirritant, and also you've had anaesthesia as well, so we would recommend that you don't drink for a while. Okay, if you do drink alcohol, that is. Okay, not very often, so it's not going to be an issue for you. So do you have any questions? Okay, well, it's been wonderful to be able to make you feel better. Okay, and I'm happy I was able to come back today and do this and check you over. Okay, so I'll get my nurse to come and give you a little chat and check things out for you, help pack away your things, and I'll get you out of here in an hour or so maybe. Okay, it all depends on how quick the pharmacy can issue your medicines. They are particularly busy as always, but you know, we'll get you out as soon as possible. Yeah, and if you want any more refreshments in the meantime, just ask the nurse. Okay, all right, my lovely, you take care. And I'll check you back at my clinic in a month's time, if that's all right. Okay. Take care. Bye-bye.